South Carolina hospitals are once again reaching their limits due to an influx of COVID-19 patients.
Dozens of hospitals are over 90% full that is. Julia Kaufman tells us more.
As crowds formed at events over the weekend, hospitals are dealing with their own crowds.
The number of hospitals today that are at or above 90% capacity is 32 in their general acute care beds. And we also have 27 hospitals that are at or over 90% capacity in their ICUs. Those are record-setting numbers for the beginning of a week.
Melanie Matney, COO of the South Carolina Hospital Association, says many hospitals are struggling with high numbers of patients and low numbers of staff.
Most hospitals have beds available in their hospitals. They just don't have the staff to staff them. You'll see some hospitals are over 100% capacity. That's because they are surging internally and creating additional space.
Meanwhile, people are attending events without masks or social distancing, and the majority of South Carolinians are not vaccinated.
It really, truly is the unvaccinated who are driving this surge. It's tough not only on the patients' families, but it's also really tough on healthcare workers who don't necessarily go through this amount of death all the time. And to know that it's preventable is what makes this so difficult.
According to DHEC, 84% of hospital beds in Lexington County are filled. Orangeburg County hospitals are 79% full. Kershaw County is the highest in the Midlands at 91% full. The latest data shows there are nearly 2,500 people hospitalized for COVID-19 in South Carolina. 568 are in the ICU.
We've had hospitals have to request morgue trailers.
To deal with the surge in patients, Matney says hospitals are trying to hire more staff and are creating room for additional beds. Some hospitals have requested help from the National Guard. But Matney says the thing that'll help most,
all of us need to get vaccinated.
In Columbia, Julia Kaufman, News 19, WLTX.
Hospitalizations continue to rise. More COVID-19 patients are requiring acute care. DHEC says that 403 COVID-19 patients are currently on ventilators in our state's hospitals. That's up about 19% over a week ago.